Assalamu alaikum warahmatullahi wabarakatuh. Today's paper is going to be the presence of Enterococcus in root canal infection based on next generation sequencing. A systematic review and meta-analysis was done by Liu et al. In Wuhan, China, and published earlier this year in the International Endodontic Journal. Chronic applique periodontitis, affecting approximately 52% of the global population, is a significant public health concern. Applique periodontitis arises from microbial infection categorized as a primary root canal infection, secondary root canal infection, and persistent root canal infection. Enterococcus faecalis, belonging to the genus Enterococcus, is widely recognized as a key pathogen implicated in root canal reinfections and secondary applique periodontitis. Due to its resistance and survival capabilities in harsh root canal environments, however, conflicting evidence exists regarding its prevalence in these infections when detected via next-generation sequencing technologies, which offers a broader microbial detection compared to culture or PCR methods. They had two objectives, primary and secondary. So first, to systematically analyze NGS-based studies to compare the prevalence of Enterococcus among secondary secondary root canal infections and the persistent root canal infections, and also the primary root canal infections. And the secondary objective is to evaluate the prevalence and relative abundance of Enterococcus at each infection stage. So their study selection, they had a systematic research conducted across multiple websites from September 2005 to October 2024, supplemented by gray literature and hand searches. For the inclusion criteria focused on studies using NGS to characterize root canal microbiota with strict definition for the secondary root canal infection, persistent root canal infection, and the primary root canal infection, and controlled sampling methods. For the exclusion criteria, the exclusion studies relying on culture or PCR methods, unclear diagnosis, or confounding factors like recent antibiotic use. For the final inclusion, 28 studies with 16 reporting explicit detection rates of Enterococcus included in the meta-analysis. For the data extraction, the data on the sample size collection methods, infection type, detection rate, relative abundance, and the NGS platform. Also, odd ratios and bacterial taxa were extracted. The risk of bias assessed using the GPI prevalence critical appraisal checklist with studies meeting 3 to 8 criteria. For the statistical analysis, meta-analysis using common effect model for the primary outcome, the prevalence differences between the secondary root canal infection and the primary root canal infection, and the random effects model for the secondary outcome, which is the prevalence within each infection group. Multivariate meta-regression and subgroup analysis examined sample collection methods, paper points, hand or rotary instruments versus cryogenic pulverization region, and the next generation sequencing platform as sources of heterogeneity. Sensitivity analysis tested robustness, and for the key findings, the detection rates for Enterococcus was significantly higher in the secondary root canal infection than the primary root canal infection, with an odds ratio of 2.6. And for the pool prevalence estimates, for the secondary root canal infection, it was 40%. For the persistent root canal infection, it was 44, which was the highest. And for the primary root canal infection, it was 27%. For the impact on the sample collection method, in the primary root canal infection, the CP method, processing apical resection or extracted teeth, yielded a significantly higher detection rates of Enterococcus, which was 76.8% than the PP method, which was 11.3%. For the cryogenic pulverization method also showed a higher prevalence in the secondary root canal infection, which was 50% versus the PP method, which was at 31%. Though this difference was not statistically different, statistically significant in multivariate models, CP allows a deeper sampling, including the tiny tubules, which PP methods may miss. We have a relative abundance of Enterococcus varied in the secondary and primary and persistence. For the primary root canal infections, it was the lowest when it was 0.0008% to 2%, and the highest in the persistent root canal infections, which was 2% to 10.5%. And Enterococcus was generally not predominant genus, often persistent at a low relative abundance. So the influence of region and the next generation sequencing platform, there is no significant impact of a geographic region on prevalence. The subgroup analysis suggested the differences between next generation sequencing platforms, but meta regressions did not confirm significance, likely due to the small sample size. And for the sensitivity and the publication bias, the sensitivity analysis confirmed robustness of pooled odd ratio estimates, though two studies influenced directionality. Funnel plots showed no obvious publication bias for the main outcome. So the meta-analysis supports a higher prevalence of Enterococcus in the secondary and the persistent root canal infections compared to the primary infections. The higher prevalence in the persistent root canal infection may reflect that the microorganism's ability to survive chemomechanical preparations and its capacity to invade the dentinal tubules. The significant effect of sampling methods underscores the difficulty of detecting Enterococcus with traditional clinical sampling, which is PP, as it may reside deep within the dentine. Despite its presence, Enterococcus is typically low in abundance and may be secondary opportunistic colonizer rather than the primary pathogen in the root canal infections. Functional characteristics of E. faecalis, including biofilm formation resistant to antimicrobial agents and virulence factors, supports its persistent and potential role of treatment failure. Lastly, the limitation includes inconsistent reporting thresholds for bacteria abundance and lack of standardized definitions for the infection types and the variability in the clinical sampling and treatment protocols across the studies. So, lastly, Enterococcus is present in all types of root canal infections, but it is significantly more prevalent in the secondary and the persistent. And the sample collection method substantially affected the detection rates, with the cryogenic pulverization providing more comprehensive detection than the clinical paper point sampling. So Enterococcus is generally not dominant microbial genus based on abundance data due to the observational design heterogeneity of the included studies. Casual inference about Enterococcus as a primary pathogen in root canal infections remain uncertain. Further functional and longitudinal studies needed to clarify the pathogen role of Enterococcus in applicant periodontitis and treatment outcomes. And thank you.